I just wanted to thank everybody for joining me today, for taking time out of your busy weekend to join me. I'm Dr. Kaya, and I am so thankful to have the chance to support you in your journey to improve your health. I'm a chiropractor and acupuncturist here at Yost Family Chiropractic, and I am motivated to educate and help you feel your best so that you can enjoy all that life has to offer. So enough about me, let's go ahead and begin. There's a good chance that you've experienced some form of neck pain at some point in your life. Causes of neck pain can range from poor posture, sitting at a desk for long hours on end, or more serious pains like whiplash. No matter what the cause, we have a natural solution for preventing further strain and to get you back to normal. So let's begin. If you do have any questions during our time, feel free to post them in the chat box. I will do my best to respond to everybody, but let's go ahead and dive right into the matter. So whiplash, what is whiplash? Did you know that whiplash is medically known as cervical acceleration deceleration syndrome, or CAD? Whiplash can be very painful. It's a very painful injury, and it can occur when the neck and head are suddenly forced backward into hyperextension and then forward into hyperflexion. This rapid motion puts the cervical spine or the neck through extreme stress and thus often results in an injury. So let's talk a little bit more in detail about the cervical spine or the neck, okay? So the cervical spine, the neck is made up of well-engineered structure of bones, nerves, muscles, ligaments, as well as tendons. The cervical spine begins at the base of the skull and continues through a series of 7 bones or vertebrae, which connect the upper back and shoulders. The cervical spine is remarkably strong and flexible and allows movement in all directions. The cervical spine also houses the spinal cord, which is responsible for sending messages from the brain to control all aspects of the body. The spinal cord is essentially your lifeline. A lot of people think of chiropractors as back doctors, but as chiropractors, we are really influencing the entire nervous system. Because the cervical spine is so complex and intricate, the risk of developing painful conditions can be really high. So what are some causes of whiplash? Whiplash injuries are caused by little tiny micro tears of the muscles and tendons in the neck from a sudden force. And it can be caused by an impact or a blow that causes your head and neck to jerk in a rapid motion, typically forward and backward, but can also sometimes be side to side as well. Injuries can occur from physical assault or incidents like being punched or shaken, things like contact sports or sports-related conditions like football tackle, as well as auto accidents. Rear-ended motor vehicle accidents are the most common cause of whiplash. So let's talk a little bit more in depth about that, auto injury specifically. To understand the most common form of whiplash injury, let's look at the mechanics behind what happens during a collision from behind. So on impact, the cervical spine or the neck is forced upward against the head, which compresses the spine along with all the nerves that live there. So the torso accelerates forward, but the head does not. This creates a natural C shape of the cervical spine to become an unnatural S shape. That can cause damage to the structures of the neck. So the head goes backwards into the seat, which damages some soft muscles at the front of the neck. Then the head rebounds off the seat and rapidly whips forward, which can further injure the soft tissues in the back of the neck, okay? So you don't have to be going very fast in order to get whiplash. Whiplash injuries have been recorded in accidents when vehicles were moving less than 10 miles an hour. Some studies have shown that accidents as little as even 2 miles per hour can cause damages to the small muscles as well as the ligaments in the neck, okay? So let's talk about whiplash symptoms. The most common symptom of whiplash, no surprise, is neck pain. This pain can range from mild to excruciating, and other common symptoms can include neck stiffness, worsening pain with neck motion, loss of range of motion in the neck, headaches which start at the base of the skull, tenderness or pain in the shoulder, upper back, or arms, tingling or numbness in the arms, fatigue, dizziness, even sometimes nausea. Some other less common but symptoms can include blurred vision, ringing in the ears, known as tinnitus, sleep disturbances, irritability, difficulty concentrating, and memory problems. So symptoms can be immediate, or they can be delayed for up to 24 hours following an injury itself. Okay, so let's talk about the recovery. Most whiplash injuries can be recovered within a few weeks to months. However, in some cases, pain can continue for several months or even years if you do not get any treatment. So seeking treatment early on following an injury is crucial. It's very recommended to improve the effectiveness of the treatment itself. Longer recovery times can be impacted by the severity of pain at the time of the injury, any type of post-traumatic stress disorder, injuries occurring at an older age, and then gender. Females are actually more susceptible to whiplash and longer recoveries than men. Let's talk a little bit now about diagnosis. Because whiplash lacks physical signs of injury, diagnosis can be a little bit complex. In order to properly diagnose whiplash, a chiropractor will first complete a full patient history. This usually entails gathering a family history, understanding any pre-existing conditions, followed by questions regarding current symptoms and the accident itself. A physical examination will then be performed. Examinations start with an observation of posture and then move on to feeling for tenderness or tightness while testing the range of motion of the neck mobility. If nerve irritation is detected, further testing can be performed to examine reflexes, muscle strength, and sensations. If a fracture or any neurological issues are suspected, diagnostic imaging such as X-rays or even an MRI or a CT may be ordered for you as well. So let's talk about some classifications of whiplash. To help with the diagnosis of whiplash, some doctors will use the WAD classification, which was developed by researching available medical literature regarding whiplash-associated disorders. So WAD classification helps to bring clarity in order to properly diagnose and create treatment plans. The classification system for whiplash-associated disorders, WAD, is separated into 5 different categories. Okay, so grade 0. That is no signs of symptoms whatsoever. Surprisingly, you don't actually have to have signs in order for you to have whiplash. That's called a grade 0. Next, we'll move on to a grade 1. This is neck pain, stiffness, or tenderness, but you have no limitation in range of motion, no loss of strength, swelling at all. Next is a grade 2. This is the most common. This is the one that involves neck pain, stiffness, tenderness, as well as limited range of motion, a little loss of strength, and then some swelling as well. Grade 3 is everything with grade 2, except you have the addition of then some neurological signs, which we would be able to find during examination. A grade 4 is neck complaints with an associated fracture or dislocation, which is why it is so important when we do an exam, if the doctor feels the need to order any necessary diagnostic images, that we do that. Okay, let's go ahead and go on to treatment options. There are a number of treatment options available depending on the severity of your whiplash. Mild symptoms may be healed with self-care treatments, whereas more moderate to severe symptoms may require medical treatment. Okay, and some of the things are manual manipulation, physical therapy, acupuncture, massage therapy, sometimes in severe situations, things like injections. Let's go ahead and take a deeper look into some of these. So as a chiropractor, I always want to make sure that we talk a lot about what is chiropractic care. Okay, it focuses on disorders of the musculoskeletal system and the nervous system, as well as the effects of those disorders on your general health. It's also used to correct any number of ailments, including back pain, neck pain, pain in the joints, arms, legs, and even headaches. As you've probably guessed, whiplash is commonly treated by chiropractic adjustments, okay? Chiropractors have a broad diagnostic skill set, and we are also trained in recommending therapeutic and rehabilitative exercises, as well as providing nutritional, dietary, and lifestyle counseling. We utilize a hands-on, drug-free, holistic approach to healthcare that improves patient things like includes patient examination, diagnosis, as well as treatment. Our job as chiropractors is to improve the structure and function of the cervical spine following a whiplash injury, which will result in faster healing and improved symptoms for you. Let's talk about some self-care treatments. Self-care options are appropriate for mild symptoms and can be done from home. Here are some options. Number 1, rest. Take it easy for a few days. This will give the injured muscles time to heal. Try to limit motions of the neck in strenuous activities until that muscle tension is gone. Next, ice and or heat. The first few days following a whiplash injury, it is very important to use ice. After the first few days, at least the first 48 hours, you can then begin to alternate between ice and heat. After a week or so, you can stop completely with the ice and go all heat. That's going to really help the muscles relax. You can also use over-the-counter medications like NSAIDs. However, these should be recommended by a doctor to help reduce inflammation. What we like to recommend is turmeric. It's got black pepper in it. It's very anti-inflammatory. It can really help speed up the healing process. Next, manual manipulation. So manual manipulation, utilizing a slow mobilizing movement, is performed by a chiropractor either manually with our hands or with a tool like an activator or a pro adjuster. It's used to manually adjust the spine to increase range of motion and therefore reduce pain. Keep in mind that chiropractic treatments can vary depending on the individual case of whiplash, though some commonly used techniques can be manipulation, muscle stimulation, which is muscle relaxation, various exercises, and some ergonomic and lifestyle changes as well. Okay, next let's talk a little bit about physical therapy. Manual therapy is a hands-on form of physical therapy where treatment is delivered with the hands as opposed to with a machine. We often utilize manual therapy in conjunction with chiropractic adjustments. This works when pressure is applied to the muscle tissue to manipulate the joints to decrease pain caused by muscle spasms, muscle tension, and joint dysfunction. Techniques include soft tissue work and massage. Sometimes a more intensive physical therapy regimen treatment is needed, and we work hand in hand with physical therapists. If that should be the case, we actually refer to a set of physical therapists. So if that was ever something you were interested in, you can always let us know, and we can refer you right over to a physical therapist that we work hand in hand with. Next is acupuncture. I am a chiropractor and also an acupuncturist here at Yost Family Chiropractic. Acupuncture can seem a little intimidating. However, many people report pain relief following acupuncture treatments. The process of acupuncture involves placing teeny tiny thin hair-like needles into various pressure points to address specific pain in the body, which then stimulates the central nervous system, which aids the body's natural healing process. These tiny hair-thin needles are gently inserted into the skin and then left anywhere between 20-25 minutes. No pain is associated with insertion, though some people report a tingling sensation, feeling relaxed, or feeling energized during that time. The process of acupuncture releases opioid peptides, which have a natural analgesic effect for pain relief. So it's a natural pain relief. Increased release of neurotransmitters as well as neurohormones are also things that happen accompanied with acupuncture. So that plays a huge role in pain management. If you're curious how it works, like I said, we do acupuncture right here in the office. If you want to give it a try, give us a call. We'd be happy to schedule a consultation. Next is massage therapy. Massage therapy is another great treatment that can be combined with manual manipulation to soothe muscle tension as well as increase blood flow, thus decreasing tension to improve flexibility and increasing endorphin release for reduced pain. Many chiropractic offices offer electronic muscle stimulation via interferential current, which helps the tight contracted muscle return to a relaxed state. Treatments are 10 minutes each, and we use them in combination with chiropractic adjustments here in our office. Next, I want to talk a little bit about injections. Keep in mind, this is in a severely complex case. A medical doctor may recommend an injection to target a specific troublesome area. Cervical or neck epidural steroid injections can be used to release, more so to reduce nerve and tissue inflammation from something like a disc herniation. Again, we're talking more severe here. Cervical facet joint injections can be used to provide relief within the joint itself. Trigger point injections can be used to help irritate a muscle bundle. The goal of injections is to relieve pain associated with inflammation around the nerves in the neck and are used to deliver medication directly to the problem area in order to progress with a rehabilitation program. So this will not fix the problem. It's a nice quick fix Band-Aid to kind of take the pain down so that we can get in and do some rehabilitation on the neck itself. This is very important, okay? So you're in our office getting treatment, which is great, but what you do at home is equally as important, okay? So I want to talk some home exercises. As a chiropractor, we also recommend various exercises to restore range of motion of the neck. Before trying the following exercises, you can apply a warm heat compress to loosen the muscles, and that will also help prevent any further injury as well. So head rotations, moving around to the right a few times and then moving around to the left. Very gentle. If you do feel any pain, never ever press it, but just doing these gentle motions on a daily basis, even multiple times a day, can really, really help. As seen in the picture here, tilting the head to the side and then coming back up to neutral, tilting it to the other side, and just holding for 10 to 15 seconds in each position can help influence and increase range of motion. Bending the neck towards your chest and then up towards the ceiling. And then, of course, shoulder rolls. Rolling the shoulders forward, rolling the shoulders backward. These are home exercises you can do every single day within the comfort of your own home. That will really, really help facilitate the healing as well. Next, let's talk sleep habits, okay? So the way you sleep can cause additional damage when caring for a whiplash injury if you're not doing it right. So let's make sure to avoid sleeping on your stomach, as this can cause strain on already injured tissues, thus slowing recovery. Try using a firm, supportive pillow, but avoid using more than one. Ideally, you need one that can support the natural curve of your neck, like the ones we have here in our office. Another helpful tip, if you have trouble sleeping, try applying heat, again, to the injured area to help relax the muscles before lying down, or try taking a nice hot shower before bed. That can help relax the muscles enough to fall asleep. Very, very important, maintaining good posture, okay? Maintaining a good upright posture will help reduce stiffness and pain associated with whiplash. Proper posture will also help heal the soft tissues faster. So try keeping your back straight while sitting, standing, and walking. If you spend a lot of time using a computer, try adjusting the screen and your chair to avoid additional neck strain. You can get up from your seat frequently to realign your spine and set yourself reminders to check if you're hunching over. So if you have a watch or a phone, or say if you work into an office where the phone rings, every couple minutes, you can use that as a reminder, a gentle reminder. When the phone rings, remind yourself to sit up straight. Make sure your head is over your shoulders and not hunched forward at all. So thank you so much for taking the time to experience this class on whiplash. We love helping people feel their best no matter what you're suffering from. If you have any further questions, please post them in the comments. You can email us at info@yostfamilychiropractic.com. You can always give us a call to set up an appointment, a consultation. Our phone number here is 515-278-9678. Last but not least, if you're not already following us on Facebook, YouTube, and Instagram, please, please, please follow us. We post a lot of content there. Most importantly, I just want each and every one of you to have a great day. I did include some reference lists, so if you guys are interested in those, just let us know. You can reach out and we can send you those references. Thank you again. I really enjoyed our time together today, and please let us know what you have gained from this class, and don't forget, if you feel like you need support, we're more than happy to help. Have a great day, everyone.